This is a VA patient, and I was asked to evaluate his file and see whether he would be a good candidate, also sent to us by a colleague from medical oncology. And he, on paper, he fits the diagnosis and he fits the eligibility criteria. However, we need to do a screening scan, PSMA, and we did the screening scan, and I had the uncomfortable position of having to tell him. And unfortunately, I knew that in his mind, he had 4 lesions. And I knew from the scan that he has at least 10. So the good news is that we can enroll you in the trial based on the finding that we have from the scan, because all your cancers, you have more lesions than what you knew you had. However, all of these lesions are showing expression of these receptors that we're going to target by therapy. So don't be discouraged by the number of lesions. I explained to him, he had a lot of questions about what's the world of theranostics, what does that mean, and all of that. And then he basically looked me in the eye and said, okay, I trust you.
Radiation is nothing to play with, because, like when it was first displayed, it was used for destruction. So but now it's still destruction, but it's specific and isolated.
And he's responding, but you feel the weight when you feel you are the last hope for something like that. So I pray that he would be one of the responders as well. So far, we're in the right direction, but you don't know till you finish the full course and see the response to treatment. Some patients would respond better than others.
If his scan follows the same course that we have seen in the example patients that Dr. Osmond brought back from Australia, he has a great chance for much improvement.
I said, I know you're a scientist. The God I serve sent you to help me. But you know what he said to me? He said that, but he also sent you to help us. So I said, so I laughed, I thought I didn't expect that.
Prostate cancer is one of the most frequent cancers in men, and it's very exciting to have this new technology available to them. And I must say that the St. Louis VA is the only VA enrolled in this clinical trial. So our veterans who have volunteered to participate in this clinical trial are opening the doors for near miraculous therapy to other veterans throughout the U.S.